Welcome to the Beyond Physio Podcast, where we help you move, excel, and inspire others on your journey to your next level with knowledge and advice from experts and testimonials from our like-minded community.
Lindsay, it's really a pleasure getting to know you, and I'm really looking forward to having you speak to our audience today about your expertise, which is in pelvic floor physical therapy. And it's always great to meet with colleagues who have this expertise because our ideal client, we have a lot of men and women over 40 who are active, and we still have a lot of people talking about how, it's normal to pee. It's to wet yourself, I should say, when you work out. And this is not the case.
Correct.
But anyway, but Lindsay, as a founder of Her Body PT, talk to us about your journey as to how you became a pelvic floor physical therapist specifically.
Yeah, I started out in the world of orthopedics back in Chicago, and when my first son was born, I went to my OBGYN 6-week postpartum check, as we all do, and I said, I need help. And the doctor said, go see a pelvic PT. And I was like, a what? And I was mortified because this was not part of my education at a pretty reputable graduate program.
Yeah.
We didn't dissect that part of the body during lab. We didn't talk about any of these issues. So my first experience was actually as a patient, not as a clinician.
That's interesting.
And that really inspired me. So when we relocated to North Carolina a year later, I said, hey, I'm going to try and get into this world.
That's amazing. So based on your personal experience, how did pelvic floor physical therapy help you?
It just opened my eyes up to the fact that, like you alluded to a minute ago, a lot of these problems are so common, but they are not normal. And I didn't have to accept the fact that because I was pregnant and because I birthed a child, I shouldn't be able to hold my urine when I jump or sneeze or laugh. So it really helped me get back to being active without some of these issues that were plaguing me for a little while there.
I'm so glad you said that because I can tell you, even just last week, talking to a mom of 2 who had said, and I actually, what I've learned over the years is to ask certain questions of our active moms, because if they have low back pain, we find there's a correlation. They often have something going on with the pelvic floor. And so one of the questions we ask in our intake is, hey, do you have any issues with either dysfunction with intimacy, or do you have any dysfunctional issues with urinary bladder issues? And they often say, oh yeah, when I work out or when I lift, I sometimes pee my pants. I'm like, all right, I need to send you someone. So let's talk about that.
I'm so happy to hear you say that, because I think a lot of medical providers are not asking these basic questions. When I go for my annual physical, they give me the anxiety questionnaire, but no one ever says, do you have pain with intimacy? Do you leak? Do you feel heaviness down there? So it's refreshing to hear that someone that's in a position to help men and women is at least and asking the questions, opening the door to that convo.
Yeah. It's funny, actually, Lindsay, my personal experience, I was actually interested in getting into male pelvic floor PT because
do it.
There's a lot of guys out there, and I think you might be in our audience, where you might have problems with intimacy, with getting an erection, or you may have other issues of leaking as well. This is very common in guys too, but we, as many men are, they tend to be stoic about it, or they tend to not want to tell other people because it's embarrassing. But it's a very solvable issue with the right kind of physical therapy. So I was surprised when I went to take my course on this, and I was poked and prodded in areas I didn't expect. But it was eye-opening for me just how dense the musculature is down there, and how important it is to maintain the health of the muscles around the area surrounding the private parts to make sure that can function both sexually and also with everyday bowel movements and bladder movements.
Yeah, I am fully supportive of you venturing into that niche also, because there are not many men treating the male population, and there is a great need.
Yeah, it's funny you say that because during the course, Holly from Herman Walls,
Yeah.
before she even started, said, hey, listen, I know there's some guys taking this course, and if there's any interest whatsoever for you to consider becoming a male pelvic floor therapist, I will refer everyone to you.
Yes.
We have a big need for this. There's a lot of guys who are really in need for this, and really became, for me, I was like, oh, this is something I really need to consider at some point as a specialty. Haven't gone there yet, but something I need to consider for sure, especially for the men out there who often get overlooked with these kinds of issues and end up with serious issues because they didn't know or because they didn't tell anyone.
And are very often treated for prostatitis and given loads and loads of antibiotics before someone suggests that perhaps there is some pelvic floor muscle dysfunction causing the urgency with urination, the constipation, the pain with ejaculation, the pain with erection, pain with sitting.
Awesome.
It's totally overlooked.
That's crazy. Hey, listen, if you're a guy out there and you are having any of these symptoms that Lindsay or I mentioned, either pain with intimacy with your spouse, or if you have any other kinds of symptoms that Dr. Lindsay had mentioned, highly recommend that you look for a local pelvic floor therapist, maybe male or female. That doesn't need to get that help. But oftentimes the solution is not very complicated. And oftentimes you can get relief very quickly from what I understand.
Yes, I would agree.
So let's talk about I would say, some of the myths that surround pelvic floor dysfunction, because one of the things that I still hear, Lindsay, is, it's all about Kegels. And what I learned from the class that I took was that Kegels are often overprescribed. And as a result, people often have too much tension in that area and they just can't get loose.
Exactly. I think back in the day, we thought Kegels were the prescription for just about everything. And now what we're becoming more and more progressively aware of is the fact that tension, so shortened, tight, restricted, hypertonic pelvic floor muscles, can actually be the reason why we're leaking. So the pelvic floor has mobility, just like if you bend your elbow and extend your elbow, the pelvic floor needs that same ability to contract and relax. And if someone has a very tight, overactive, contracted pelvic floor, then it doesn't have much ability to absorb shock when the system is rattled by a jump, a hop, a sneeze, a cough, and then the gates open and we experience leakage. So often we have to lengthen before we strengthen. That rule, we hear that, we talk about that with patients in the orthopedic world. The same thing carries over in the world of pelvic floor rehab. Kegels, if someone has a tight pelvic floor, can actually make the issue worse.
Wow. So how would you, when somebody does come in with tightness of that area, what are some of the things maybe that you can share with the audience, what a session might look like?
Yeah, so working on that connection between the breath and the pelvic floor is usually, for me, the jumping off point. There is a really cool ultrasound video that I keep on my phone to share with patients, but it demonstrates how, as we take a deep breath in, the pelvic floor drops, it descends, it lengthens, it melts, if you will. And as you exhale and the diaphragm moves back up towards the head, the pelvic floor naturally lifts and contracts a little bit. So just having patients understand that connection between the breath and using that good, deep 360 inhale is a strategic way to get relaxation of the pelvic floor. Working on different yoga poses can be another way for men and women to target lengthening of those muscles. Working on something called a reverse Kegel. So without the goal being to strengthen, the goal is to drop and melt those muscles. So those are, for me at least, like the top 3 initial go-tos.
That's awesome. Now, I realize we should probably take a step back and talk about what exactly anatomically the pelvic floor looks like so that people can get a visual of this. Is there a way you can describe that a little bit?
Yeah. So the pelvic floor runs in the pelvis from the front of the pubic bone straight back towards the spine and up the sides of the hips. So an easy visual is to imagine it looking like a bowl or a hammock at the base of the pelvis, and it has 4 primary functions. So number 1, it is a support structure for all the pelvic organs sitting on top. Number 2, some of that musculature wraps around the urethra where urine passes. Some of the musculature wraps around the rectum where stool passes. So it's the job of the muscles to keep the gates closed when we want everything to stay up and in, but also to fully relax for us when we want to empty our bowels or our bladder. Number 3, they play a role in sexual function. And lastly, because of where they're attached, they are considered part of the core. So if someone is doing a core strength program and isn't bringing any awareness to the pelvic floor musculature, in my opinion, you're omitting a pretty integral muscle group.
I agree. Yeah. And it's funny because I would say, and this is why I see oftentimes people with pelvic floor issues have low back issues chronically, is because they cannot engage the core enough because they're letting leakage, if you will, not being able to contain the pressure inside that system. So that becomes an issue where, because of that, you can't maintain the stability that you need to require to get the kind of core strength that you need to get. And
I think it's also important to discuss how when the pelvic floor becomes tight, it could be because it's trying to compensate for some nearby friends that are weak and unstable. So when someone has chronic low back pain, for example, the pelvic floor may say, hey, I got you. I'm going to kick on, I'm going to turn on all the time to try to take some strain off of you. And to your point initially, that's another reason why we might see some tension and hypertonicity form. It's because it's overworked, because there's some muscular imbalances.
That's amazing. Now, let's go back to some myths. What are some other myths regarding the pelvic floor, maybe even among clinicians, that you still come across?
Well, I would say another big myth, maybe not so much among qualified clinicians, is that pain with sex is normal, is okay, especially after women have given birth or after men have had prostate surgery.
Yeah.
It's, again, common, not normal to experience any sort of pain with penetration.
That's interesting. And so in that case, would it be more likely that somebody who has that kind of pain is likely because they have more hypertonic, so they have more tight muscles? Or
I would say yes. Generally speaking, that's true. There is also this element of the mind-body connection and trauma responses. And when anyone has gone through a traumatic experience, we know the body keeps the score. We hold that in our body. There's been an interesting study years ago that correlated TMJ dysfunction with pelvic floor dysfunction, and it makes a lot of stress when we're tense. When we've gone through something heavy, we tend to clench and grind our teeth. We tend to do the same thing down in the pelvic floor. It manifests differently, so we're not as aware. So for a woman that has just gone through the trauma of childbirth, and yes, in my opinion, it is trauma. It ends in a beautiful thing, but it is a traumatic experience for the vast majority of us. The body holds on to that. So when something is coming at that area, whether it's a speculum, a finger, anything coming towards that area, it would be a natural response of the body to be like, heck no, nothing's coming in there. I'm not going to let that hurt you again. And then we start to see this gripping, tense response build, and that can be the source of pain.
That's amazing. Now, I would say one of the things we talked about on our last meeting was how even with pelvic floor PTs, that some of them actually forego doing an internal exam altogether, which I thought was fascinating because how would you even know or assess whether the area is tight or loose? Is that something that you wanted to talk about?
Yeah, I don't know how those therapists, they must be mind readers. I unfortunately have come to learn that there are PTs that are selling themselves as pelvic floor PTs, and they are electing not to do internal pelvic exams. I think that is really difficult to treat because then you don't know what you're dealing with. You may just be making assumptions and giving the patient Kegels, for example, because they're telling you they're leaking when the issue is really this hypertonic pelvic floor that needs to be stretched and lengthened and relaxed. So we run the risk of exacerbating symptoms if we're not doing our due diligence. And we also have to get in there and do some scar mobilization if a woman has sustained a tear during delivery, if there has been surgery in that vicinity. Certainly men, again, after pelvic procedures and surgeries can benefit from manual therapy to those muscles.
Yeah, that's crazy. Now, talking about the type of population that you work with, basically women experiencing everything from urinary incontinence to diastasis recti to pelvic pain. Can you break down a few of the common conditions that you see and how you approach treating them?
Yeah, I think the three most common ones that I see is urinary incontinence, prolapse, diastasis recti, and probably pain with intercourse.
Got it. And as far as how you approach these things, what are some things that women, because I often hear this with the diastasis recti, where a lot of women complain about having the separation there. What are some things that you've been able to prescribe to women as far as exercises or anything that you do in physical therapy to help them get over that?
I think the number one thing I would encourage all therapists and patients to be considering is pressure management, because diastasis and prolapse, for example, are really driven by poor pressure management. So if you have a patient, a client that is doing a lot of abdominal work, and every time they do a crunch, for example, they're looking at their belly and they're saying, oh my gosh, it looks like an alien is popping out, it's coning, it's doming, maybe it's a hernia. That is an example of poor pressure management. And learning how to control pressure before you initiate that exercise by zipping up. So always starting in the pelvic floor, doing a little contraction, a Kegel, working your way up to that deep core system, turning that on, exhaling with exertion as you complete the exercise. Those are ways to manage pressure.
That's really curious. And I know with urinary incontinence, there are several different types. Can you talk about those?
Yeah, the first one is stress urinary incontinence. So that's a type of urine leakage that would occur with a trigger like a sneeze or a cough, a sudden change in position. And the volume of leakage could vary from just a little drip to women or men having to completely change their undergarments. Urge incontinence is the type of leakage that might occur when you feel the need to go and maybe you're not making it to the bathroom, or you hear running water, or you put your keys in the door, garage opening. I've heard it all, and that can trigger leakage. And then there's a mixed urinary incontinence, which is a lovely combination of both of those things.
That's crazy. When a woman comes into, if say somebody who's maybe in their third or fourth trimester, Is there a benefit to seeing a pelvic PT before they even deliver?
Yeah, I think there's huge value in that. Learning about labor and delivery positions that may be most optimal in this country. It is most common to deliver on our back in a traditional lithotomy position.
It's terrible, I think, right? Not
I think it's probably not ideal. I think
Yeah.
that's how most physicians in this country are trained, and that's where they feel most comfortable getting that baby out. And at the end of the day, safety is the priority for mom and baby. That said, when we're laying on our back, the backside of the pelvis has no room to open up. So there's a lot of misdirected pressure.
Sure.
And then we see a higher incidence of tearing and some pubic symphysis related issues. So yeah, I like to talk to women about their options, knowing that they can advocate for themselves. And even with an epidural, we still are not needing to be immobile.
Interesting. And so in an ideal world, what do you think that the position of woman birthing should be?
I think the answer is whatever position the patient in the moment feels most comfortable being in, and not getting too committed to being in any one position. That said, certainly if I could do it again, I would elect to be in a quadruped position, hands and knees, or even side lying with some support.
Yeah.
Those are the two most likely options if an epidural is in place. Otherwise, weight-bearing positions, squatted positions, using a birth bar. Let's get off our back.
Exactly. I heard something about a story where the women had used to basically squat when they were delivering, but something about, I forget what king it was, thought it was atrocious, and that's why I decided to have women on their backs or something like that. I could be wrong. I remember reading something that was very interesting to me. That was something that was back then. How
That's
they had done
interesting.
things.
I'm going to have to look into that.
Yeah, if you can, that'd be great.
Yeah.
Let's talk about the kinds of populations where, for example, we see a lot of runners, we see a lot of women who are hybrid athletes, and guys for that matter. And it seems that this population, because they are under a lot of exertion and postpartum, maybe they have developed some weakness in the area. What are some things that you might do to help get them back into a lifting program if they've, let's just say, for example, you discover that they've had weak pelvic floor muscles? How would you maybe progress somebody from that into where they can start lifting and running again?
Yeah. So again, assuming we've ruled out that tension is an issue and it's just a purely weakened pelvic floor, then we would start working on teaching them how to contract appropriately. And that's key. Like 90% of women do not perform a Kegel correctly. It is a squeeze of the pelvic floor, but it is also a lift of the pelvic floor. And a lot of patients across the board don't get that lift part.
They just squeeze.
They just squeeze.
Yeah.
So a squeeze and a lift, and teaching them how to do that in coordination with their breath, because pelvic floor is the support from the bottom, diaphragm, breathing muscle, is support from the top. So coordinating those two muscles is really important. I think making sure that when patients are returning to running activities, they've got really good core strength, especially with single leg activities. They can maintain a good 360 breath while they're running. They're not breath holding, which would be an example of poor pressure management. I'll see that a lot. Sometimes our runners need a little internal support in the form of a pessary if they are experiencing chronic leakage or prolapse symptom. Pessary is a viable option while they're doing some pelvic floor training.
That's really interesting. And that it's almost like you're providing this progressive resistance over time too while you're doing that, from where they're using their body and learning how to use the right muscles to help the core to engage properly. And then you can also use devices to help them to get to where they can get back into a program where they're doing what they will love to do anyway.
Yep.
That's awesome. So tell me about maybe your most interesting case, if you're allowed to.
Let's see.
Obviously, names out.
Okay. I had a patient that had just had her 5th child. This is the one that's jumping out. And she had a very severe case of pelvic organ prolapse. And for those that maybe aren't familiar with prolapse, that is when any of the pelvic organs can descend in towards the vagina. And there are different degrees of that. Grade 1 would be pretty mild. Grade 4, the bladder, for example, could start coming external to the vaginal opening. And I would say she was a pretty severe grade 3. And very distraught over it because it was affecting her ability to parent and function and return to exercise. And initially, I'll be honest, I didn't feel overly encouraged, but She pulled through, and she was able to avoid surgery, which her urogynecologist had said was almost for sure on the table. And she put in the work. And just like you see in your practice, you know, when you're compliant with the recommendations that are given to you and you follow the overload principle and you really commit to making change, it is possible. And it was very exciting.
You just blew my mind because I've not heard that you can actually manage this with pelvic floor PT. I thought you actually had to get the surgery.
Yes, everyone. It can be managed conservatively. Now, there are some cases where surgery is the best option, but mild to moderate prolapse can usually be reduced by at least 1 grade.
Oh, wow.
And as I like to tell women, and I'm a pretty open book, I have a little bit of prolapse and it ebbs and flows. I know what's going to trigger it, but I know what I have to do to reset.
Yeah.
And I think the goal of therapy is to give patients a real clear, concise toolbox and use those tools when they need to reset things, but knowing what triggers it.
Yeah.
Like constipation is a big one. Is a big one. I think one of the biggest ones.
Wow. So then you probably talk a lot about diet too, I would imagine.
I do. I try to stay in my lane as a PT and not a nutritionist, but I do find that constipation can be one of the biggest drivers for pelvic floor related issues in men and women.
Yes.
So you can visualize the bladder in front and the rectum sitting right behind it. So when the rectum is full and backed up, it can put pressure on the bladder. Again, in men and women, it can make us leaky.
Yeah.
It can cause prolapse.
Yeah.
And if we're pushing and straining to defecate, then that can cause prolapse and it can cause weakening of the pelvic floor. So I probe a lot of my patients about their bowel health, even when they say, I poop every day. It's great. Let's look at this picture of your, does it look like small hard pieces? Does it look like a sausage? Because common misconception, one of the myths that you can you can poop every day and still be considered constipated.
Yes.
So if you're having, and it's called the Bristol stool scale, if you're having type 1s or even 2s every day, you might still be constipated, and that could be driving a lot of your pelvic floor dysfunction. So that has to be the jumping off point. We can't fix the other stuff if you've got this thing lurking in the back giving you problems.
Yeah. Remind me, for 1 and 2, what does that look like on that scale?
So 1 are like the turds, the hard turds that are difficult to pass. 2 are the hard turds, but a little bit more form. 3, we're getting there. 4 is shape of a sausage, consistency of peanut butter, easy to pass. You feel empty after going. Patients that feel like they haven't completely emptied after defecation, to me, that's a red flag for what's called a rectocele, which is a type of prolapse where the rectum prolapses to the vagina. So you develop like a poop pocket, essentially. So patients feel like, good, something's getting stuck.
Yeah.
And that can be a sign that there's some prolapse. But again, working on bowel management, toileting posture, breathing mechanics while we're toileting, adequate hydration, good fiber. That's all really important patient education that needs to be included.
I want to talk about the breathing during defecation, because what I had learned, I think it was from the course, was that you should actually consider inhaling as you're releasing at the same time. Does that make sense?
Yeah, I've heard it taught a little bit differently from course to course. I know that's an option. Traditionally, I tend to teach patients to pretend you're blowing bubbles out of a bubble wand as you're gently bearing down. We don't want to do a Valsalva maneuver. I think that's like the main takeaway is don't pretend you're birthing a baby on the toilet. Breath holding puts an immense amount of pressure down on the pelvic floor and with time can cause fissures and hemorrhoids and some of the other fun stuff that I mentioned. So breathing period is crucial. How you do that, that might vary a little.
So then you're probably a fan of, oh my God, I forgot what it's called now, the squatty potty?
Yes, I wish they would sponsor me. How many squatty potties have I recommended? I think everyone should be using a squatty potty.
Yeah.
If my husband's listening, I brought one home and he's like, this is an eyesore and no one's going to use this. And we laugh now because my 12-year-old son will go to the bathroom where the squatty potty is. Awesome. I'm going to have to send him to college someday with them. Yeah, squatty potties or just any sort of step stool. Taking a roll of toilet paper and putting 1 foot on each roll of toilet paper is another way to simulate it. So when you're traveling, you don't have to tote your squatty potty around. You could simulate it, but you want to get those feet elevated so that your knees are slightly higher than your hips. That's good toileting posture.
That's awesome. And tell us why. I know why, but let's let our audience know why that's important posture for when you have to take a number 2.
It promotes relaxation of the pelvic floor. So if someone has a tight pelvic floor, it's hard to evacuate. We may feel like we have to push or strain to override that tension. Putting your feet up on that stool will allow the muscles a better chance of just letting go, melting into the toilet so that it's easier to defecate without straining.
Yeah, it's funny because as a lot of our clients are also looking to how can they optimize their health, Lindsay, and as a result, this is something very simple that they can do, and it doesn't require dollars really. And so whether it's how you position yourself to take your number 2, whether it's getting your pelvic floor checked, if you've been having any kinds of issues below there, you can stop a lot of bad things from happening too. What are some things that can happen that maybe people don't know if they ignore pelvic floor issues?
As is the case with most things, nothing tends to get better naturally as we age, from a physical standpoint at least, and preventative medicine is key. So I think all women, as is the case in many other countries, should get physical therapy postpartum. Even if you think you're doing okay, have someone qualified check you, because some of these things can go overlooked. And then we start going through hormonal changes during perimenopause and menopause. And now all of a sudden these issues are rearing their heads that we probably could have caught 15 years before and might not be where we are now. So I think when you have the opportunity to have someone screen you and looking at posture and pressure management and core strength and pelvic floor function, that might be really helpful. And it's never too late. Women in their 70s and 80s, men too, there's always opportunity for improvement.
I like that. And it's funny because one of the things that we preach to, for that matter, Lindsay, is we want to help people stay ahead of issues. And that's one of the reasons why we do a free consultation for people who are looking to maybe get even better at what they do, or wanting to not get injured because they've had a history of injuries and they want to stay ahead of these things. And it sounds like having a pelvic floor exam for men and women would be something that would be helpful regardless of whether or not you actually have an issue.
That's right. And I think a lot of patients will go to orthopedic PT for some time due to back pain or hip pain. And sometimes we make progress, but we don't fully get there. And the missing piece sometimes is, in fact, the pelvic floor and trigger points that might present and refer pain to these other areas. So if someone is dealing with chronic issues that are stubborn and you just hit a wall, I think also knowing that could be an important missing piece to get checked out.
That's awesome. Now, talk to us about Her Body PT. Tell me about your practice, where you're located, and how you deliver your services.
So I decided to start Her Body PT so that I could make physical therapy accessible to women that are having trouble getting out of their home. So I offer mobile services in and around the Triangle. I'm located in Raleigh and will service areas in the nearby towns and communities. I bring a treatment table and all of my supplies, and it allows women to really feel comfortable in their own space. Some of these issues are difficult for women to talk about. There are lots of stigmas, as you mentioned earlier, and just being in a space that feels really soothing and relaxing to them may make it easier. And with children at home and jobs and life, having someone come to you is a concierge service that I'm happy to be able to offer.
That's awesome. And I'm so glad you're doing this for many of the women out there. Who do you refer men to if they have an issue, Lindsay, or do you see them as well?
Yeah, there are plenty of places in the area that are working with men. All of the hospital systems will treat men, and lots of the private outpatient clinics in the area. I would say generally most pelvic floor PTs are treating men and women alike. Some are working with pediatric population on some of these issues.
Yes.
So there are definitely plenty of options.
That's awesome. Lindsay, thank you so much for coming on our show and talking about this area of our body that doesn't get a lot of attention when it comes to its function. And I think people like you in our field who are making this known to people and helping bring awareness there, but also helping people live a transformed life because they're finally getting things addressed, is so critical. And I'm glad that we have a place in the Triangle area that we can refer our clients to who are having these kinds of issues.
Yeah, thank you for having me and being willing to have this conversation. It's great.
Yeah. What's the best way for people to find you?
Yeah, you can go on my website, herbodypt.com. You can send me an email, and I also offer free phone consultations just to make sure it's a good fit for both of us. And you can also follow me on Instagram.
Excellent.
Yeah.
We'll make sure we have all your contact information in the show notes.
Great.
Thank you so much, Lindsay.
Appreciate it.
Thanks so much for tuning into today's episode. It really does mean a lot to us. And don't forget to share, subscribe, or comment if you got at least one or two helpful insights or takeaways to help you get to your next level.